Yeah, I couldn't agree more with Yusuf. I mean, I think that the reality is we're in a tough financial era in global health generally. And to make the case for these investments is going to just get tougher and tougher over the next few years. But and that was the rationale for the creation of the Foundation for a Smoke-Free World, now the Global Action Against Tobacco. Um, I would hope we would see even greater focus on their work in low middle income countries. In fact, you could argue they should be spending 100% of their resources in low middle income countries, given the fact that there are vast resources available in the US and Europe to tackle tobacco and tobacco harm reduction. And anything we can do to both build the human capacity, which lives on for years and years in low middle income countries, will be incredibly valuable. Um, I think when it comes to the private sector, we do need to look and afresh at how we actually bridge the divide between companies committed to ending smoking. And that includes, of course, the more contentious ones on the tobacco industry side, but also the pharmaceutical industry. And I haven't seen major efforts by the pharmaceutical industry in low middle income countries to step up their work on smoking cessation research to build the research base that would be needed. And ideally, in time, we need to see them all recognizing that while there are obvious conflicts of interest, there must be ways in which we can have pooled funding put into national budgets to support tobacco harm reduction, given the enormous costs that it imposes on cancer and cardiovascular disease and so on. And remember, this comes at a time when we now are fully aware of the fact that for most African countries, the cost and the treatment of the cancers caused by tobacco are well beyond the budgetary capability, which means that people are going to seriously suffer. And the only solution is going to be a higher focus on prevention and preventable approaches, of which tobacco stands as the starting point.